Without further ado, it's my great privilege to introduce Professor Mark Scott, who is the 27th Vice-Chancellor of the University of Sydney. Mark brings to the university a really valuable experience as a highly respected and successful leader in large and complex institutions across public service, education, and the media. Under his leadership as Secretary of the New South Wales Department of Education, he secured a record 10-year funding agreement for public schools. He created a school infrastructure in New South Wales to deliver the additional 160,000 classroom places. He established the School Leadership Institute to train and develop aspiring school principals across the state. And he established policies around the protection and expansion of Aboriginal languages in New South Wales schools. Professor Scott is an accomplished communicator, and his distinguished record of strategic leadership includes a decade as Managing Director of the ABC, where he led the organisation's transformation to the public broadcaster in the digital era. I'd like to welcome Mark Scott and thank him for his great support for the Brain and Mind Centre throughout his tenure, and we look forward to his words of wisdom. Thanks, Mark.
Well, thanks to Professor Kiernan and Professor Hickey and my colleagues at the Brain and Mind Centre, and to all who are joining this Brain and Mind Centre annual symposium today. Can I begin by acknowledging traditional owners and the lands in which we're meeting? I'm on the land of the Cammeraygal people this morning, and I want to extend my respect to elders past, present and emerging. I also want a special shout out to the Brain and Mind Centre after their wonderful result tonight at last night at the Prime Minister's Science Prize. Associate Professor Michael Bowen being awarded the Prime Minister's Science Prize for New Innovation. I think a part of a great night for the University of Sydney, a barnstorming run to collect 3 of those prestigious Prime Minister's Science Prizes. And I think a salient lesson actually drawn out of those prizes for a lot of the discussion you're going to be having over the next 2 days about basic research, about translation, about using research to really be applied to real world pressing problems for the public good. And I want to talk a little bit about some of that today. You know, there's no doubt that the multidisciplinary focus that we see at the Brain and Mind Centre and the strong focus on translation is a hallmark of the work that's taking place and is a model for so much of what's happening in research across the country and in universities across the country. Our best researchers come together and working on that translational pathway from labs to clinical trials, but also being assertively involved in key policy debates and key community engagement initiatives. And I think for us at the University of Sydney, the BMC models the future of what really can be happening in the Australian model of education, which is by and large a model of large, comprehensive, and in many cases, research-focused institutions. If you look globally, Australian universities are big, they are comprehensive, but that really provides enormous opportunities for us to engage deeply with multidisciplinary initiatives to address some of the most pressing problems that's affecting our society today. And there's no doubt that the BMC's network of multidisciplinary researchers and clinicians, they are asking the big questions to find answers to some of the world's greatest health challenges across the lifespan, from childhood development at one end to youth mental health, and then all the complexities about an increasing ageing population. What is also clear to me is the alignment between the energy and focus of the work at the BMC and the most pressing national health priorities that have been identified. We've had the Royal Commissions into the aged care and also the mental health system that's operated in Victoria, and the BMC strong engagement with both of those processes. And then importantly, the advocacy of the BMC and other researchers around the country, seeing there's very significant increases that were evident in the 2021 federal budget, aged care spending up $17.7 billion through the forward estimates, and also a big increase in mental health spending and a focus on mental health research. And so engagement in the policy drivers, being in the room that's shaping the direction of national reform, that's a key part of the work that BMC is doing. But also, I think, very importantly, and I see this strongly with my background in running a very big education system here in New South Wales, and before that being involved in the media and public broadcasting, the the public advocacy and the public education that BMC is involved in doing is absolutely vital. Some weeks back, I recorded a podcast with Ian Hickey and James O'Loughlin, the Minding Your Mind podcast, addressing all aspects of mental health with a particular focus on the impact of COVID-19 and the prolonged lockdowns on the community, from burnout to anxiety in children and all the other matters that we're facing. And then from that, the Keeping the Kids in Mind series of webinars that were held through September and October, delivering approachable, evidence-based advice through conversations with experts, a gathering together of the great minds, the great researchers working in these issues, working in children's health through the pandemic. And then at the other end, the BMC's Ageing and Neurodegeneration team developing a toolkit to help families and carers supporting people working with dementia through COVID-19, and the toolkit now being widely available on the BMC website. You know, it strikes me that this is a great example of what we talk about at the University of Leadership for Good, and engaging the work that we are doing on the great pressing problems that we face as a society. And it was interesting, as a leader of organisations and talking a lot with staff, I could see the pressure that COVID brought to bear, particularly on those who had young children at home, trying to keep them learning and focused and engaged through all the complexity, particularly with schools shut down, and those with care and responsibilities, particularly for the elderly or those with significant disabilities, the pressure that came to bear, and giving people the practical tools they need to help manage some of that pressure, vitally important. You know, I think it's just fair to say that our academics who are working on these pressing social problems are the antithesis of that perception of academics working in an isolated ivory tower, door shut, averting their eyes to the world, engaged in toiling away in splendid isolation. There's no splendid isolationism here. This is active engagement. And when it comes to Ian Hickey, of course, we know he's everywhere. I'm fully expecting him to be announced as the new host of Radio National Breakfast when Fran Kelly leads. Ian is everywhere and playing such an important role in educating the public on these issues of complexity. Let me lift the attention a little bit to broader lessons, I think, for the higher education and research sector that have been evident, I think, through COVID-19. I was talking earlier about the University of Sydney's great success in the Prime Minister's Science Prizes last night, and Eddie Holmes was announced as the winner of the Prime Minister's Prize for Science. And Eddie, of course, became famous globally for that tweet that he sent out in early January 2020, where he pointed the world's researchers to the posting of the genetic information, the genome that underpinned the COVID virus, the coronavirus at the time, therefore triggering the frenzy of work by researchers around the world to understand that virus better and to be able to develop the vaccine. And there's no doubt when history writes the story, one of the things that they will tell is the story of the speed from, in a sense, that initial diagnostic of what we were dealing with to the development of vaccines that were then tested as safe and then rolled out globally at remarkable and unprecedented speed. And I think it's very interesting. I'm speaking to you today from New South Wales, clearly, where New South Wales has gone through 89% double vaccination for the COVID vaccine, 89%. And that's all the more remarkable given how slow we were in starting. It took us a long time to get going, but when we got going, we really got going. And if you think that all this has happened since early January 2020, it's all the more remarkable. But I really like what Eddie has said. He said, yeah, 30 minutes posting that, but 30 years in the lab preceding that, giving him the deep disciplinary understanding, the deep complex understanding about how viruses work and operate, that gave him the capability that when it really counted, to do the work that would have such enormous practical impact. I think COVID is an extraordinary case study for the importance of translational and multidisciplinary research endeavours. And strong translational research programs have been the key to combating the COVID-19 pandemic. And And it's interesting to me, there's been a lot of discussion about universities during COVID-19, and there are two key areas that have been identified for that. One is the pressure that universities' operating model has been put under by international students being unable to travel. And I'm pleased to say the University of Sydney has done very well in holding on to our international students. But the other thing is, I think the policy settings that emerged from Canberra, particularly around JobKeeper and a deliberate decision that was clearly made to not include universities in those kinds of financial rescue packages, a sense that universities were fine on their own. Now, that's a separate debate for another day. But, you know, the universities, the role and function of universities were clearly very much part of that public discourse early on during COVID-19. I would say then, remarkably, where we sit now, COVID-19 has proved to be the university's finest hour. As researchers, multidisciplinary researchers from across all fields have come to the fore to fully engage with this problem. And we have shown that we can mobilise multidisciplinary activity at speed to address great pressing social problems. Nature has reported that 4% of the world's total research output, more than 100,000 articles in 2020, was devoted to COVID-19. At the University of Sydney, in our latest count, our researchers have published almost 1,400 articles on topics as diverse as the history of pandemics, sequencing the genome of the virus, public health response design and modelling, infection prevention and control, vaccine development and rollout, mental health and well-being, and how to open up Australia more safely. And we've engaged at multiple levels around this. Nearly 3,000 of our university staff have been directly involved in COVID response through research, public health advice, or provision of frontline services, many in our Faculty of Medicine and Health, working after hours in emergency wards on COVID response, setting up vaccination clinics. And I was delighted that our famous Great Hall at the University of Sydney is currently operating as a vaccination centre. I mean, part of the challenge of COVID is that in living memory, this level of disruption is unprecedented, and it's been difficult to predict precisely what the course of this would be. And even Eddie, in his comments last night after winning the award, was predicting still the level of uncertainty as to the path of the virus from here. But again, this is where our expertise comes to the fore. And Ian Hickey and Professor Murray Thiessen from the University of Sydney have been at the forefront of the urging of the engagement around the pressing mental health problems that are emerging on the back of the COVID shutdowns. Not just what we've seen already, but what we might be seeing emerging now, and urging politicians and policy leaders and other practitioners to be prepared for the challenges that lie ahead. I think if we look at the Eddie Holmes story and other work we see around COVID, we understand that basic research and translation absolutely go hand in hand. And we understand the need for the practical delivery of transformational outcomes on the back of our research, and the fact that we need to be highly skilled in those translational activities. But at the same time, I'm strongly urging the federal government, as they appropriately focus and encourage on translational efforts, to not neglect particularly the funding and support of basic research, the upstream research that makes translational efforts possible, the funding of researchers like Eddie Holmes over the last 30 years that allowed this transformational translational effort to take place in the last 2 years. And I've written about this in the Sydney Morning Herald this morning. If in fact we are going to have great translational efforts in 2031 and 2051, they will come off the back. They will come standing on the shoulders of the basic research that's happening in our laboratories now, with our research teams now, and we need to hold both together significantly and well. I think one of the things, as I've said, that we can be very, very encouraged about is the way that we have demonstrated when necessary we can deploy the army to the challenge, and that we can move and operate at speed. We have moved from the lab to the bedside with enormous speed over the last 2 years. I'm delighted in this symposium today that these next 2 days that you've got truly world-class speakers who are going to be engaging with you on some of the big health challenges we face globally. Professor Sarush Irani from Oxford will be talking about the rare combination of neuroscience to cover both the basic and clinical science, so expertly, and he's renowned for important discoveries in basic science, right up to diagnosing and treating the significant disorders that he's working on in the central nervous system and other mechanisms as well. I know you're going to look forward to hearing him. And Professor Iona Novak from the Central Palsy Alliance, the Chair of Allied Health, and her work in evidence-based practice and collaboration research has led to changes in clinical care in 24 countries. These are researchers whose work is having profound impact. I'm also delighted when I look at the program to see a great focus on our emerging thought leaders and early career researchers who are being invited to present their innovative work in brain and mind sciences alongside their more established peers at this symposium as well. Very conscious of the fact that early and mid-career researchers have been adversely affected by the COVID disruption. It's interrupted research and it's provided fewer opportunities for engagement and advancement. And we want to do all we can to secure the pathways of early and mid-career researchers, because that's essential for Australia's future as a knowledge economy. We need the next generation of researchers to solve the research challenges that face our society, and we want to support them in a central part of their career. And in my early time here as Vice-Chancellor, I'm focusing very steadily on that as issues. Just a few other thoughts from me, and then I'll hand back to the experts that you're clearly looking forward to hear from. One of the things I think you can see through the Brain and Mind Centre and the work of the multidisciplinary initiatives is that a capability that's going to be vital for researchers in the future and universities in the future is to be very good at partnerships. We need to be able to work with our partners in other research institutes, within the university itself, with other universities, with research institutes, and with governments to allow for the collaborative design and implementation of strategies that really lead to transformation. I've been very clear on this since I've started in my role at the university. We need to be great at working with others. And to be frank, I'm not sure that's always been the reputation of the University of Sydney or the university sector generally, but we know that the most complex issues we face will only be solved in multidisciplinary endeavours, and the key to multidisciplinary endeavours will be good and productive partnerships. And so we look forward to being outstanding at that, and there's no doubt to us, the Brain and Mind Centre demonstrates how that happens, the way they work in the university and the way they reach well beyond the university. Great example of that is the Mental Wealth Initiative that has recently been developed, where they partner across borders and across disciplines to pursue better treatments for conditions of the brain and mind. And there are many other examples across the university sector as well. I was delighted that the state government came in and has funded the Australian Pilot Facility to develop mRNA and RNA drugs and vaccines, a partnership between the state government and all the universities in New South Wales. And in fact, the University of Sydney has recently signed an innovation partnership with the New South Wales state government to streamline collaboration on research opportunities and to attract investment to find really good partners for these research initiatives that we've got underway. One of the things I learned when I was running the ABC is that a lot of people are in Canberra asking for money. There's a lot of knocking on doors, there are a lot of begging bowls out. And in reality, you don't want to be in that queue of people. There are very worthy people, very worthy organisations and parts of society that need government funding. But to my mind, that's not the powerful way to attract the funding that we need. We need to be in the solutions business. We need to demonstrate how, in working with government and being funded by government, we are in a position to help deliver solutions to the most pressing problems society face and the greatest challenges that governments are expected to lead us on. So to be in the solutions business and be providing practical solutions to the pressing issues that we face as a society, that's very much where we need to be. And that's what I think we see from the work of many of the researchers we're hearing from. In conclusion, just a personal observation, if I can. I want to thank you for your engagement in this vital area of brain and mind research and all that that means. When I was running the New South Wales education system, I was struck at the sheer complexity of the task of a classroom teacher. The brain is the most complex object discovered in the universe. And if you're a classroom teacher, you have 30 of those growing brains that are confronting you each day. No wonder it's a demanding and an exhausting job. But there's no doubt that there would hardly be a family in the country that is not or has not been compellingly engaged with pressing challenges that relate to brain and mind issues. From challenges with mental health, with the complexity of young people and growing minds, with all the challenges of ageing in our society. And like every family, I've had those experiences. And it did strike me some years ago, I had a family member with significant mental health issues that proved to be very complex to deal with. And I had another family member, it's well documented, my wife, who'd never smoked, was diagnosed with lung cancer and had a very tough pathway of treatment. And she's now well, and the other family member who'd had the mental health issues are now well too. But I was struck, as my wife is in the hands of great cancer experts, the laser-like precision that was coming to bear on the treatment of cancer now. And the extraordinary technology that was available, the extraordinary funding for some levels of cancer research, though not the lung cancer that she was diagnosed with. In fact, I saw some parallels between the funding for lung cancer, which is viewed as a sin cancer, and the funding for mental health research. And Professor Patrick McGorry and I will talk about this extensively when I was running the ABC. And we ran a big suite of programming to help find engagement around mental health funding. Because again, I think given its impact and given the incidence in the community, mental health research is still dramatically underfunded compared to other diseases. But we are all affected by this work in profound ways. And so as you do great multidisciplinary work on the mind and brain challenges, the full gamut, you can be assured that that work is going to have a profound impact on every Australian family and a global impact as well. We have to go to work, all of us. We have responsibilities and things we need to do. If you're going to spend many, many hours every week at work, you may as well invest that time on things that are of vital impact and importance. That is what your research is doing. I want to thank you for your efforts and thank you for being part of this symposium. Over back to you, Matthew.
Well, thanks very much, Mark. It's really fantastic to hear your words and your great support for translational efforts, for promoting engagements, and I think multidisciplinary approaches to complex issues that we deal with here at the Brain and Mind Centre. And I'd like to, I suppose, provide reassurance that we are not an ivory tower, and we are very much into the solutions business. So it's great to have your support, and you're thinking through these sort of complex issues, but also we welcome your sort of guidance and leadership and your help in promoting brain and mind more generally. So thanks for giving your time up this morning and for really launching the symposium in a translational theme. Thank you again.
Pleasure.